The facts on tampons and toxic shock syndrome. For factual medical and nutrition information, please subscribe to our channel. If you use tampons during your period or menstruation, it's important to know how to use them safely. Know this important information from the U.S. Food and Drug Administration and please share this information with other people who may use these products. About 70% of all American women use tampons. On average, a woman will use between 11,000 and 16,000 tampons in her lifetime. What are tampons, and how are they used? Tampons are one method of absorbing menstrual flow during your period. Tampons are designed to be inserted into the vagina with or without an applicator. You may be surprised to learn that the FDA regulates tampons as medical devices. Tampons cleared by the FDA are meant to be used one time and then thrown away. No tampon should be used more than once. What are tampons made out of? FDA-approved tampons are made of cotton, rayon, or a blend of the two. The absorbent fibers used in FDA-approved tampons sold today are made with a bleaching process free from elemental chlorine, which also prevents products from having dangerous dioxin levels, a type of pollutant found in the environment. Are reusable tampons safe? Reusable tampons may carry more risks of infections such as yeast, fungal, and bacterial infections. You may have heard about reusable tampons. The FDA has not approved these products. The FDA advises not to use reusable tampons. The only tampons are approved by the FDA are designed for single use. What should you know about tampons and toxic shock syndrome? Toxic shock syndrome is rare and is caused by a toxic substance produced by certain bacteria. Some types of Staphylococcus bacteria produce a toxin. Not all staph or strep infections cause toxic shock syndrome. The toxic substance produced by the bacteria can cause organ damage, shock, and even death. The organs include kidney, heart, and liver failure. How can using tampons cause toxic shock syndrome? A tampon, warm and soaked with blood, is an ideal place for bacteria to grow. Sliding it into the vagina also may tear the vaginal walls and allow the bacteria to get into the bloodstream. When toxic shock happens with menstrual sponges, diaphragms, and cervical caps, it's usually because they've been in the vagina for 30 hours or longer, or, with a sponge, pieces of it remained in the vagina. Is toxic shock syndrome dangerous? It is a rare but life-threatening condition caused by bacteria getting into the body and releasing harmful toxins. It's often associated with tampon use in young women, but it can affect anyone of any age, including men and children. Toxic shock syndrome and risks of tampon use. The toxin made by the bacteria causes toxic shock syndrome, rather than the actual presence of the bacteria. Staphylococcus aureus is a common type of bacterium that lives on the skin and inside the nose. In most cases, it is harmless, but it can cause a wide range of infections if it enters the bloodstream. For toxic shock syndrome to occur, these particular types of bacteria must first overgrow and make large amounts of the toxic shock syndrome toxin, which then enters the bloodstream. Tampons can increase the risk of toxic shock syndrome in two ways, including tampons, especially superabsorbent varieties that are left in the vagina for a long time, may encourage the bacteria to grow. Tampons can stick to the vaginal walls, especially when blood flow is light, causing tiny abrasions when they are removed. Toxic shock syndrome is a tampon disease. Is it? In 1983, over 2,200 cases of toxic shock syndrome were examined, and it was determined that 90% of the patients were menstruating when they fell ill. Of these menstruating patients, 99% of them were using tampons. But it is not exclusive to tampons. It's estimated that 25 to 35% of toxic shock syndrome cases are unrelated to menstruation. These non-menstrual toxic shock syndrome cases can be caused by Streptococcus aureus or by Streptococcus pyogenes and have a mortality rate 6 to 12 times higher than menstrual toxic shock syndrome. I don't want toxic shock syndrome. What should I do? First, don't panic. Toxic shock syndrome is really rare. While several high-profile cases of toxic shock syndrome have occurred recently, the rates of toxic shock syndrome are lower than ever. Tampon companies and government agencies have worked together to identify a strategy of use that minimizes your risk. Their recommendations are as follows. Use the lowest absorbency tampon that you can. Change your tampon every 4 to 8 hours. Wash your hands before inserting a tampon. Do not use tampons when you're not on your period. Tampon safety tips. You may want to talk with your healthcare provider about whether tampons are right for you. If you use tampons, consider the following. Follow all labeled directions. Even if you have used tampons before, read the instructions in the package. Use the lowest absorbency tampon needed. If you can wear one tampon for up to 8 hours without changing it, the absorbency may be too high. Contact your healthcare provider if you have discomfort, pain, or other unexpected symptoms like unusual discharge when trying to insert or wear a tampon. If you have an allergic reaction, stop using tampons and contact your provider. Know the signs of toxic shock syndrome and how to reduce your risk. Symptoms and signs of toxic shock syndrome may include a sudden fever, usually 102 degrees Fahrenheit or more, vomiting, diarrhea, fainting or feeling like you will faint when standing up, dizziness, or a rash that looks like a sunburn. If you have any of these symptoms during your period or soon after your period, stop using tampons and immediately seek medical attention. To reduce your toxic shock syndrome risk, use the lowest absorbency tampon necessary, wear a tampon for no more than 8 hours and then throw it away, and use tampons only when you have your period. Manufacturers made changes to these products in the 1980s, and at least one brand of superabsorbent tampons was taken off the market. Opt for tampons if you are working out or otherwise on the move, are heading to the beach or a pool party, need something you can throw in your pocket. Thanks for watching. We hope this information is useful to everyone. If you liked this video, make sure to subscribe for more medical videos and don't forget to hit the notification bell.